Georgia Congressman and physician, Dr. Tom Price. Sir, thank you for being with us. I will start before we get into any...
Great to be with you.
Well, thank you, sir. Before we get into any policy, let's just talk about the heartstrings the president was tugging on with the American people. How do you go about combating that message of Natoma Canfield, the woman he talked about that sent him the letter? Her premiums kept going up. She couldn't afford it anymore, ended up back in the hospital.
Sure.
He's telling people to remember that woman, her story, her name. When you hear all this back and forth in Washington about health care, how do you just combat that message from the president when a lot of people think they just hear from the Republicans? No.
Well, what we heard was another campaign speech from the president, and the way that I combat that discussion about Natoma is the experience that I draw from upon being a physician for over 20 years, treating thousands of patients like Natoma and others who know in their heart of hearts that when the federal government gets their hands on what they're trying to get their hands on in health care, that we will in fact destroy the quality of health care in this nation. And that's what concerns me and so many of the practicing physicians across this land so much. And that is that once the government inserts itself into this process, into that physician-patient relationship, or into telling us what kind of insurance we must have, then we destroy something that's unique and of the highest quality in the world in American health care. That's what I know the American physicians are worried about, and I know that's what the American patients are worried about as well.
Patients, people, yes. But you have the President of the United States telling a story about a woman who couldn't even introduce him today because she ended up back in the hospital and insurance she can't pay for. That just, sir, is a story that's going to pull it. I mean, we all feel for this woman, but at the same time, again, how do you battle that? I hear the response you just gave, but sir, if I hear that woman's story and then I hear a Republican stand up and just to a lot of people, they just hear you say no. How are you going to just on the airwaves? How are you going to combat that the president wants to do something to help this woman? Sounds like Republicans don't want to do anything.
I hope what I explained was that in the thousands of patients, the tens of thousands of patients that I personally have cared for, they understand and we understand that what the president has proposed will destroy the ability of those physicians to care for Natoma, to care for the patients across this land. The solution isn't to put the government in charge or insurance companies in charge, it's to put the patients in charge. And though the president says that, that's not what his plan does. And you can define it and you defined it pretty well on the intro to this segment. You talked about the increasing taxes, you talked about the increasing intrusion of the federal government, you talked about the mandates, the individual mandate. In order to do those things, you've got to have the government telling people what to do. And when that happens, what it means is that you and I and every single American will not have the kind of health coverage that we want. We'll have the kind of health coverage that the government dictates to us. I think that strikes a chord all across this land.
Well, also, sir, the president did speak of, you know, had the big meeting up there that was on national television, that was live, the president bringing in a lot of Republicans, both sides, and talking, after he came from that, he did say there were some Republican ideas that he liked, including some proposals to combat fraud with the undercover investigations, increase Medicaid payments to doctors, the malpractice lawsuits, also expanding the use of health care savings accounts. Now, he sounds like he's trying to bring in some Republican ideas. Is that enough? Do we really need to get rid of everything and start over? It sounds like we're finding common ground. Are you with the president there, at least?
Well, I think on the headlines we are, but the fact of the matter is when he talks about lawsuit abuse reform, he doesn't do anything more than studies. And in fact, we know what works. You got to decrease the lawsuit abuse in this nation, and there are positive programs that we've proposed that would work. In terms of pre-existing illnesses and injuries, the president solves that by dictating to patients what kind of coverage they must have and not allowing individuals to choose the kind of health coverage that they want for themselves and for their families. We solve that in a way that allows individuals to choose. In terms of portability, being able to keep your insurance when you lose your job or you change your job, we say that individuals ought to be able to keep the insurance that they have. The president says that they ought to have access to the coverage that the government dictates. So it's this big question about who's going to decide, who's going to be making these health care decisions. Is it going to be patients and families and doctors, or is it going to be the federal government? We believe it ought to be patients and families and doctors.
Well, let me hit on a couple of things the president said, and you know it scares the dickens out of a lot of seniors when they hear that anything would be cut from Medicare. But he did say, and I'm quoting here, that every senior should know there is no cutting of your guaranteed Medicare benefits, period. Now, you agree with the president on that point?
Well, that's the top line. The bottom line is that he's going to slash $350 billion from Medicare. I don't know how you take $350 billion out of the Medicare program without rationing care.
Well, he says he's cutting waste, right? He's just cutting out some of that waste.
The payments. That's right, but you could decrease the payments to every single physician in this land and not get to $350 billion. So the only way to do that, if you look at the real numbers, is to ration care. And that's why we believe that that ought not be on the table at all. We believe there's a positive way to reform Medicare, again, that allows the Medicare, the senior citizens, to be able to select the insurance that they want, not the one that the government dictates to them. There are wonderful positive solutions if we would work together and solve these challenges. The president's top line, the phrases that he used are oftentimes the right ones. When you get down into the details, though, it means the government's going to control what's happening in health care. We don't believe that's what the American people want.
Well, you talked about what was on the table, and you talked about working together. That's the next thing I wanted to read you from the president today. He's saying every proposal has been put on the table, every argument made. Both parties found plenty of areas we agree on, but politics gets in the way. Now, I take it, would you agree with that? Has everything, for the most part, been put on the table, talked about, and the only thing left now is just to get the politics out of the way?
Well, we've had a lot of discussion. There's no doubt about it. And the American people know this plan better than they knew it 6 months ago, which is why by 2-to-1 or 3-to-1, they oppose the plan that the president has talked about. The president talks about having an up or down vote on the plan. We welcome an up or down vote on the plan. The problem is that the House isn't even going to allow the members of the House of Representatives to vote on the plan. They're going through some contorted gimmick, backroom gimmick, in order to make it so that they can get this bill over to the Senate. So the president, what the president says oftentimes sounds wonderful, but when you get down to the details, the fact of the matter is he's not following the policies that he has proposed in the first place.
Well, Representative Price, I'll let you go on this, and we heard the president kind of getting the crowd riled up there at the end, talking about we need courage now. In your opinion, who's being courageous?
A campaign speech.
Well, no, you tell me, who's being courageous in your opinion and who's being cowardly?
I think the ones who are courageous are the ones who stand up and represent their constituents instead of their leadership. If the American people have representatives in the House of Representatives and the United States Senate who represent their constituents, represent the people, and not their leadership, we'll be in great shape.
Well, Representative Price, we appreciate you taking some time. Our homeboy, I guess you could say, representative from Georgia. We'll see you when you get back down here to Georgia at some point. We'll talk to you again soon.